Hello friends, my name is Dr. Rice, and today we're going to be talking all about the differences between an MD and a DO. I know it's pretty much recommended that every physician on YouTube has to make a video discussing this at some point, so here I am. Because MDs and DOs are very similar, especially in 2021, we're gonna briefly talk about the similarities and then highlight 4 major differences. So you've just made an appointment with a new primary care physician and you astutely notice that this individual has the letters DO written behind their name. You think, does this human being really know what they're talking about? And the answer is, yeah, of course they do. DO stands for Doctor of Osteopathic Medicine, and DOs make up about 10% of all the practicing physicians in the United States. MD stands for Medical Doctor, and MDs make up about 90% of all practicing physicians in the United States. I myself am a DO for all of you who don't know that already. There are so many similarities between MDs and DOs nowadays that they're almost indistinguishable. They're both licensed to practice evidence-based medicine in all 50 states. They both function as one would think of as a traditional doctor, and both are equivocal in terms of area of certain specialties to pursue, as well as diagnosing and treating medical conditions. I know a lot of patients that I've talked to didn't even know there was a difference between an MD or a DO. And to be honest, most don't really care what letters you have behind their name. They're much more interested in how you actually treat them. So on to the differences. The most obvious difference is that DOs practice something called osteopathic manipulative therapy, or OMT for short. This is a set of hands-on techniques that manipulate your own body's tissues in order to diagnose, to treat, and to prevent illness as well as injuries. OMT is a non-invasive and low-risk way of helping to solve problems in replacement of medication and even sometimes surgery. DOs spend about 300 to 400 hours enhancing and practicing their OMT skills during their 4 years of medical school. And speaking of medical schools, DO medical school curriculums focus on a holistic approach to healthcare, and they actually have 4 tenets that are integral specifically to osteopathic medicine. The body is a unit. The person is a unit of body, mind, and spirit. The body is capable of self-regulation, self-healing, and health maintenance. Structure and function are reciprocally interrelated. Rational treatment is based on an understanding of the basic principles of body unit, self-regulation, and the interrelationship of structure and function. Again, I really want to reiterate that this is not specific to just DOs, as there are many MDs that focus on the patient as a whole. I'm just stating the emphasis that DOs have on a holistic approach, as this concept is integrated and interwoven into their medical school curriculum itself. More about schooling, MDs and DOs go to separate medical schools. Both undergo rigorous studies in everything imaginable about the human body. This ranges from microbiology and anatomy to pathophysiology and clinical diagnosis with specific treatment modalities. Both have to complete the same duration of time in medical school, which is approximately 4 years. Again, DOs have to undergo an extra 300 to 400 hours of additional coursework specifically in OMT. In general, both MD and DO schools are extremely competitive and hard to get into, requiring high MCAT scores and a high GPA, as well as having many different extracurricular activities. In general, GPA and MCAT scores required to get into MD schools are slightly higher than DO schools with that gap closing every year. However, there are significantly fewer DO schools in the country, with about a 1-to-4 ratio of DO to MD schools in the United States. So this means fewer application options for potential DO students in general. I would argue though that it's probably still harder to get into an MD school than it is to get into a DO school based on empirical evidence. And finally, there used to be different residency programs for DOs and MDs, or the period of extended training after medical school, whereas MDs could only train under the MD accreditation system and DOs could train under both. But these have since merged in the last year or so, where now both MDs and DOs train under one accreditation system known as the ACGME. Again, this kind of furthers my point before about MDs and DOs being very similar. And lastly, when choosing a doctor, the letters at the end of their name is much less significant than the way they communicate with you, portray empathy, as well as their willingness to work with you to solve whatever medical condition is affecting your life. Both MDs and DOs are highly competent in any area that they're practicing in because they both undergo rigorous board certification processes in order to practice legally in the United States. And like anything in life, you can be really good at something or not so good at something regardless of the degree that you have. As always, if you found this video helpful, please smash that like button, hit subscribe, as well as the bell notification so you never miss a video in the future. If you have any other questions about the differences between MDs and DOs, leave a comment down below. Stay tuned for future videos on medical content, and I will catch you all on the next one.